For soccer players, the header is an important part of the game, but are the players being exposed to brain damage? This report from Radio Netherlands TV.
As in many sports, playing soccer is not without risks. Doctors have always been busy keeping players fit from the head down. The head never kept them busy. If boxers suffer brain damage, why wouldn't soccer players? After all, they play the ball with their heads thousands of times during their careers. What happens to the brain?
When you suffer a severe blow, the brain can move inside the skull. And it can move from back to front, and it can make a rotational movement.
Goalkeepers also receive many blows on the head, sometimes causing unconsciousness. The effects show many years later. Dr. Matzer is convinced soccer players run risks.
That when you do have had a lot of concussions during your sporting career, then you can develop symptoms similar to Alzheimer's disease.
Doctors and neurosurgeons contacted in Singapore feel that the link between soccer head injuries and Alzheimer's disease is weak. While doctors agree that boxing is one of those sports that does do damage to the brain, soccer is not one of those that poses this danger.
Most of the injuries we have seen are from illegal elbowing of a player's head or being kicked in the head during the actual game.
Reports speak of repetitive headers that come from training sessions that can cause the greatest cumulative harm.
The soccer ball itself is a reasonably soft ball, and the amount of impact which the head receives from heading the ball is fairly small. And I don't think there's enough force imparted to the brain to cause any kind of long-term injury.
But at the Singapore Sports Council, all necessary precautions are taken.
If they should have symptoms like headache, giddiness, or nausea, they should stop and have their trainer check it out, or a doctor if there's one around,